Yes.
Great, thank you. Well, welcome everyone. We appreciate you taking the time out of your day to join us for this important session from the University of South Dakota. Before we get started, just a few points that we like to share. Please note that your microphone is automatically going to default to mute. We ask that you keep it that way during the course of the presentation to prevent any unnecessary feedback. If you have a question, of course, you can go ahead and unmute that to participate in the discussion. Please also keep your video turned on so that way we can continue having great conversations. And we do ask that you maintain confidentiality at all times during the conversation. If you have any questions, you can feel free to use the chat feature. We will be monitoring that. If you have a technical issue and you need assistance, we'll be keeping our eyes on that as well. In order to support the growth of the ECHO movement, Project ECHO does collect participation data for the tele-ECHO program. As always, we just ask that you introduce yourself when you open up your mic or you offer to make a conversation or ask a question. And just we're excited to have you here. So please be ready to learn and engage and find value in everyone's perspectives here today. If you aren't familiar briefly, I should have introduced myself from the onset. I'm Stacy Villano. I work for the Global Rural Nursing Exchange Network. We are incredibly fortunate to have a wonderful relationship with the University of South Dakota. And that's what brings us together today. Our mission is to connect nurses, students, and educators, anyone really who has a passion for improving the health of rural communities worldwide. So we work to bring together like-minded individuals from across the globe to help improve the quality of life for those individuals in rural settings. Our partnership with the USD allows us to bring forward your real life experiences and show how nursing students are having opportunities to work in underserved hospitals and clinics. And by bringing your stories to this platform, we're hoping that together we can help encourage more students to go into rural careers postgraduate. We can encourage more educators to bring rural opportunities to their students in the classroom, and we can really build a bigger perspective of how wonderful these opportunities are. As we get started today, I would like to introduce your two presenters. Helene Heggie has practiced nursing for over 35 years. She has practiced in many different clinical areas, including primary RN in a rural health clinic for 10 years. While working in the rural health clinic, Helene obtained her Master's of Science in Nursing Education. She has been a nurse educator at USD for the past 10 years. Along with Helene, we have Katie Franson, who is an instructor at the University of South Dakota in Vermilion. She has been a nurse for 14 years. She has worked in a rural health setting and continues to work PRN in a critical access hospital. Katie is the coordinator of the USD Nursing Lab and Simulation Experiences. She is also the co-lead of the USD HRSA Grant Experience, which I will then bring you to our presenters so they can take forward the conversation. Thank you.
Great. Thank you, Stacy. This is Katie talking here. So in this series, we're looking at getting to the heart of rural nursing. And the way we were able to do this is by a HRSA grant that we were awarded. So this HRSA grant was awarded to USD in the fall of 2022. We were awarded $1 million for 3 years. And there are two parts to this grant. We have the recruiting side of it, and that's recruiting nurses, especially our Native American students, and getting more of those nurses working out in rural areas of South Dakota. With that recruiting side, our team has been visiting schools, hospitals. They've been holding some fairs, attending different events across the state. Every year, the grant specifies that we visit the tribal nations 2 times a year, and there are 9 of those tribal nations in South Dakota. So to meet the objective of getting more nurses out to the rural areas, we've been placing students in rural hospitals for clinical experiences. They'll complete 135 clinical hours out in a rural facility, and then they're also immersing themselves into that community. Students take a survey before and after the experience, and to date, we've placed about 70 students in rural experiences, and all of them have reported an increased knowledge and interest in rural health nursing at some point in their career. We have extended the grant, so we are excited to be able to offer this opportunity for a little while longer. So, good.
All right, well, because we're honored to have a global audience with us today, we're just going to go over a little bit about where South Dakota is in the world. And so South Dakota is located in the northern central part of the United States, which is located in North America. And then, as you can see, South Dakota is a little bit at the northern, but it is in the central part, and it is in the Midwest, is what we call our area in the center part of the state. And so now we're going to look at a map of South Dakota in itself. So all of the X's that you see on the map are places that we have been, that the nursing students have been placed in rural access hospitals across the state of South Dakota. And the dynamics of South Dakota is quite vast and different from different regions across the way. So the western part of South Dakota is where the Black Hills is, and where, of course, Mount Rushmore is. It's a popular destination for travelers. And the terrain out there is mountainous. And so the hospitals out there are rural access hospitals, and kind of unique in the problems that they see in those rural communities on the western side of the state. On the eastern side of the state, there is Sioux Falls, which is the largest city in the state of South Dakota. And then, as you can see, on the western side of the state is Rapid City, and Rapid City is the second largest city in the state of South Dakota. The population of South Dakota is, I don't have the exact population, but it's in the upper 800 to 900,000 range. So across this vast area, there's less than 1 million people in this population. And if we would go from the western end of the state to the eastern end of the state, it would take us about 7 to 8 hours to travel that far. So that kind of gives you an idea of how there are lots of miles and not very many people across the state. So the University of South Dakota is located in Vermillion, and that is in the southeastern corner of the state. We also have a campus in Sioux Falls as well. And some of the students that will be presenting throughout this series are from both Vermillion site and Sioux Falls site. The presenters today, however, are all from the Vermillion site of USD Nursing. So then, in talking about in between Rapid City and Sioux Falls, it's very rural, it's vast, and it's wide open, a lot of prairie land, farmland. On the eastern side of the state, there's more farming going on, and in the south central and southeastern, farming. But then in the central and northern central, it is a lot of pasture land and range land. So it is quite a unique state in that there's different areas and terrains, but yet our whole state is pretty much classified as rural. So that's a little bit about South Dakota. So the social determinants of health are important for our health and our survival. And the World Health Organization and the CDC use social determinants of health to identify weaknesses in communities. And so with the social determinants of health, there are 5 main areas that are addressed, and that is healthcare access and quality, neighborhoods and the environment, social and community context, economic stability, and education access. So our previous presentation, we talked about education access in rural communities and the challenges and barriers to that. But today, our topic that we're going to talk about is access to food that support health. And so we will be hearing about an overview of the clinical experiences and then also addressing access to food that support health in rural communities of South Dakota. So as Stacy shared with us, this is an all teach, all learn session. So this isn't a presentation as opposed to more of a conversation about food access. And we really want to hear from those attending this today to talk about what the food access looks like in your community and what barriers you have identified for food access, or what good things are going on in your communities for access to food and to promote health. So our 3 objectives for today is we are going to identify health challenges in rural communities of South Dakota. And that will be from our 3 nurses that completed an immersion experience in a rural health setting. And then we're going to discuss barriers to accessing healthy food in rural South Dakota. And then we're going to talk about the value and the influence of access to food on health and different programs that are being conducted here in rural South Dakota. And so now we are going to start with our case studies. And so it is my privilege to introduce to you Vanessa Herrig. And Vanessa is a nursing student, as I said, on the Vermilion site. And Vanessa is from Slayton, Minnesota. And Vanessa chose to do her clinical immersion experience at Avera DeSmet Memorial Hospital in DeSmet, South Dakota. And her future plans, she will be graduating in December, and her future plans are to work at a hospital, Sanford Hospital in Sioux Falls, on the orthopedic unit and neurology unit to begin with. The DeSmet Hospital is a very rural, and Vanessa will tell more about this, and it is located northwest of Sioux Falls. So if you can kind of remember our map, you kind of know it was in that kind of the middle of the state where all those rural areas are. So Vanessa, we're going to hand it over to you and hear about your experiences in DeSmet, South Dakota.
Thank you. So as Professor Heggie said, DeSmet's located in the middle eastern side of the state. It's about 35 miles east of Huron and about 45 miles south of Watertown. Those are kind of the big towns surrounding it. It's a very rural critical access hospital with 6 inpatient beds. There's 2 ER rooms and then 1 outpatient treatment room. The outpatient treatment room sees a lot of the action during the day, people coming in for outpatient infusions for various conditions, whether it's antibiotics or steroid infusions. There are always 2 nurses on. And then during the week, during the day, there's a nurse manager and an assistant nurse manager. During the busy days in the ER, those 2 also jump into the ER visits just to help keep everything running smoothly and to prevent a long wait and get those emergencies, whether it's treated and discharged or treated and transferred, in the most efficient way possible. The Avera DeSmet Memorial Hospital serves the whole Kingsbury County, being the critical access hospital, the only one in the county, with a lot of smaller towns and communities. We also saw a lot of international immigrants from Huron who worked primarily in construction, coming into the emergency room with kind of construction injuries, and they were coming in later for more of the tertiary treatment of diseases because in their previous lives before they moved to Huron, they weren't seeking that preventative treatment. And I really enjoyed DeSmits Hospital, and all of the community members we got to interact with were very appreciative of having the small town hospital available to them.
Vanessa, did you ever have to transfer anybody to another facility at all?
Yes, we had a few, and that process looks a little bit different depending on the type of transfer. Like if they need an ambulance transfer, those sometimes take a little bit longer because right around the DeSmit area, there's two primary ambulance services, and one's a BLS and one's the ACLS. So depending on the type of transfer, sometimes waiting for the Lake Preston ambulance to be ready to transport takes, depending where they're at, what they're doing, takes a little bit longer. And I know DeSmit's very big on allowing family transport in non-emergent situations. Like I know a couple we'd give their fluids to, we'd give them their first dose of antibiotics, and then family could transport just because they didn't need anything in that exact moment, and it would be faster for a family to take them as opposed to waiting for the ambulance service.
So how about if you had a critical patient that needed to be transferred? How long, you said it was the Preston ambulance that had to take that, and how long would it take for that ambulance to get to DeSmit then?
Of course, the two towns themselves are about 10 miles apart. I know both times we used that service to transfer, we got pretty lucky and they weren't on calls. So it's a volunteer-based ambulance crew. So getting the page sent out, getting a response, both times we got pretty lucky, and our report was given and they were in the ambulance at about 35 minutes after the page was sent. So that was kind of by ground. And then in the event that a person needs to be life flighted, they have that option as well. And those helicopters typically come from Sioux Falls. So those, they urge that if it's a super urgent situation, I know DeSmit's very big on, especially in the summer months, some near drowning accidents and motor vehicle accidents. When the hospital gets the page to the ambulance crew to page the helicopter team sooner rather than later so that they're en route faster. While I was there, we didn't have any of those experiences, but I've been told those are quite quick.
Sure. So how far of a drive is it to Sioux Falls for those that go by ground ambulance?
It's about 75 to 80 miles, like from hospital to hospital. So
I'm just thinking of how long it takes for if a patient has a major problem at home, and then how long it takes for the ambulance to get to their home and then transported to the hospital. And then if it's an urgent and they need to take the ambulance to the hospital and they wait a half hour for that other ambulance to come, and then it's over an hour transfer. That's a lot of time.
mm-hmm.
Yeah, gosh. Yeah, thanks for sharing that. So who goes with the patient then when the patient is transferred to Sioux Falls?
So depending on the type of transfer, if it's just kind of a standard transfer that doesn't need any IV access, the BLS team takes them, or the ACLS team can take an IV infusing patient. If the ACLS crew isn't available and it's just the BLS crew, a nurse goes with them. Excuse me. Because there has to be 2 nurses on duty all the time, it's typically a nurse on their off day. Mass text gets sent out to those on the DeSmet ambulance crew. And we kind of hope one of them can go with, or we just kind of wait it out. Fortunately, every time I was there that we needed a transfer, the ACLS crew was available. So we didn't have to just kind of keep our fingers crossed that a nurse on their off day was available to ride with. But that's kind of their fallback plan. If the Lake Preston crew can't take a patient fast enough, or they're out somewhere else on another transfer, is that an off nurse goes with.
So you also talked about some workers that came to your hospital from Huron, South Dakota. And fortunately, we have another person who will be presenting that did an experience at Huron Hospital. How far away is that hospital from you?
About 35 miles.
Okay. And what kind of populations did you see from the Huron city, the city of Huron?
We saw a lot of immigrants from Mexico in particular. They actually all came the same day. It was like the group of them decided today was the day to go seek treatment, and they all came together kind of as a pack, and they were very pleasant to treat because they really wanted the help and they knew they needed the help.
Sure. And we don't want to violate HIPAA at all, but what kind of general problems did you see that they needed treatment for, seeking help for?
We saw one gentleman who was a new onset diabetic. He found out in the emergency room that day he was a diabetic. He also needed treatment for a toe wound. He was transferred. A couple of the others were in for similar kind of cuts and scrapes that just weren't healing. And we did a lot of education on how to keep those clean and different dressings to kind of put on there to keep them from getting dirty again, kind of on the job, because they weren't going to take any time off, and they weren't injuries that necessarily needed time off. They just needed education on how to be better treated at home.
Great. Well, thank you for sharing, Vanessa. Does anyone have any other questions for Vanessa concerning her experiences at the Avera DeSmet Memorial Hospital?
What was your favorite part?
I really enjoyed the kind of culture of the hospital itself. All of the nurses were very close at work and everybody was super willing to teach. So just the culture of the hospital and getting to see some, more critical access emergencies as opposed to our med surg clinicals that we get to see in Sioux Falls.
Right. Well, thank you very much, Vanessa. We're now going to move on to Kaylee Bewley. And Kaylee is from Omaha, Nebraska. And as I shared before, Kaylee did her experience this past summer at the Huron Regional Medical Center in Huron, South Dakota. She will be graduating in December and plans to work at the Sanford Medical Oncology Unit. So Kaylee, I'm going to turn it over to you.
So I was in Huron at HRMC. It's a 25-bed critical access. It has a small ICU for certain things, and then 7 ER rooms, and then it also has its own labor and delivery unit with about 8 suites, and then the nursery. I did 1 shift in the ER. We did a little bit of ICU, and then I did mostly on the regular medical unit. So on the medical unit, they usually staffed about 3 staff nurses, the nurse supervisor, a nursing assistant, and then the hospitalist. But
did a lot of, it was a lot of kind of waiting for skilled nursing facility placement type stuff. So those who maybe had a fall and couldn't continue to take care of themselves at home. So kind of just a little bit of a short stay kind of rehab type situation, and then they would get placed in a facility. Or a lot of, they do a lot of like same day surgeries, so colonoscopies, that kind of thing. So maybe some observation overnight, or if there was something that was found during the colonoscopy, they would be admitted to the hospital for further workup. A lot of our higher end stuff ended up going to Sioux Falls through transfer. We did have one patient in the ICU, but that day we ended up getting that patient transferred to the regular med-surg floor. So that was good because it showed improvement of the patient. But a lot of the people we serve are just like the town of Huron and surrounding areas. And then there's a Hutterite colony to the north that we serve as well. A lot of, like Vanessa had talked about, there's a lot of immigrants in the area as well. So that's always hard to deal with because we did have quite a few of those. And the interpretation system that HRMC has is not as advanced as the one in Sioux Falls. So sometimes you have a dialect that isn't on the interpretation system, so that's always a struggle. But we always found a way through it, and yeah.
Great. Kaylee, you had mentioned that you had followed in different areas. Did you follow the same nurse to all of those areas each time?
Yes, she actually was afloat for all four units. So she did labor and delivery, she did ER, med-surg, and ICU.
And are a majority of their nurses cross-trained like that in all those areas?
Yes.
How do they keep up with the training on that? Is there a certain number of hours they have to complete in each area? Is there monthly training or something that they do, or how does that work?
There is a number of hours of like orientation they have to do. So with that, I'm not 100% sure. I can't remember how many hours that was, but like we had one of the other med-surg nurses, she was orienting to the labor and delivery. So one day we discharged a lot of patients, so they were like, you know what, why don't you just go up and continue your orientation? So a lot of the times it's based on what the need is for the floor, because sometimes there was days where we started with 11 patients, which is usually about their max of what they have at one time on the unit. And but that day I think so we had like 3 or 4 nurses that day. I believe we discharged, between all of the nurses, we had discharged about 7 patients. So that's why they took the opportunity to allow the other nurse to go up and continue some orientation hours at that point, because we weren't getting any admissions at that point, and if we did, we had enough staffing on the floor to cover. But yeah, so there was a certain amount of orientation hours that were needed. I just can't remember how many it was.
Okay. And then is there how many nurses staff the med unit just on their average patient load? And do those same nurses cover the ER, or is that separately staffed?
So there's usually about 3 nurses because I think our average is about 8 to 9 patients. So they try to keep it to 1 nurse to 3 patient ratio. They do have separate nurses for the ER. And there's usually about 2 to 3 nurses down there as well. And then I didn't get to see labor and delivery, so I'm not 100% sure how many nurses they have up there. I think it also depends on, I think they try to keep their ratios about 1 nurse to 1 to 2 patients instead of 3 to 4. If I remember, because I did ask about that. I just can't remember the numbers off the top of my head. So usually about 2 to 3 per unit. For the ICU, because they don't use it as often because a lot of their critical patients end up getting transferred to Sioux Falls. There's a few nurses that are cross-trained into the ICU, but usually they don't usually take like vented patients and that kind of thing. So a lot of it's just like higher care, there was a minor complication with surgery, that kind of thing where they're not completely critical, but they need a little bit more attention then. So it's almost like if you were to go to Sanford and they have like their acute units, it's kind of like that rather than a full ICU. But so they usually try to have 1 nurse that is able to switch to ICU in case something were to happen. But usually you don't have an ICU patient.
Okay. And then just last question here from me. It doesn't sound like there's a separate peds unit. So do those patients usually get transferred out, or are they on your regular med surg unit?
So I did ask about that. We didn't really have any peds patients. Some of the peds patients, depending on the severity, will go to Sioux Falls or a bigger hospital. But usually if it's not like something super bad, they will just stay on the med surg floor.
Okay. Okay, great. Thank you. Anybody else have any questions for Kaylee?
Kaylee, I just want to kind of share with you, which and I want everybody else to know, the great thing about this facility, which does make a difference than some of the other rural facilities, as this is a Huron Regional Medical Center. This isn't an Avera facility or a Sanford facility. They are supported by their community. And I just think it's astounding that they have this hospital. And I do know that they partner with other independent hospitals, like Madison, South Dakota is another one. And they do collaborate, and they try to purchase things together so that to try to decrease costs. So the privately owned hospitals do try to work together for those things in rural South Dakota so that they can, just be as economical as possible. But it's just astounding to me. Isn't it? What do you think about that, Kaylee?
I think it's really important, especially in these small communities, that they do things like that, even though it's not an Avera-based or a Sanford-based hospital, because if they didn't, I think a lot of their costs, like the cost of things, would go up, and it would be a lot harder for them to afford to keep basic staffing and that kind of thing.
Yeah. So it is really a unique establishment in South Dakota. So I give them such credit for having that strong of a community to support that. It's awesome. It's great. Well, thank you for that thorough presentation. So we're going to move now, and we're going to head off to the western end of the state that we talked about when we began. We're going to talk with Tracy Molman. Tracy is from Millbank, South Dakota, and she did her experience at Monument Health Sturgis Hospital in Sturgis, South Dakota. And Tracy plans, after graduating in December, she plans on working in Sioux Falls at the Sanford Emergency Department. So Tracy, I'm going to hand it over to you.
Hello, everyone. My name is Tracy. And as mentioned, I did my immersion at Monument Health out in Sturgis, South Dakota. Here, I was dominantly spending my time on the inpatient unit and in the ER. Their inpatient unit is about a 20-bed facility that includes 2 ICU beds. And then in addition to those inpatient beds, they also have about 4 beds for outpatient services such as chemotherapy or outpatient antibiotics. They also have a 6-bed ER, and sometimes, depending on how serious situations were, they could jump that number up. So, like, the Sturgis Motorcycle Rally is a huge event out in South Dakota. And when that happens, sometimes their ER gets kind of flooded with patients. So they'll set like chairs up in the hallway or pull beds from their inpatient facilities where they do like colonoscopies, and they'll have like hallway beds in place too, so they can bump that number up to about 9 people. In the hospital, they usually have 4 nurses working, and if they can, they'll staff a crisis nurse, and that crisis nurse just really bounces around from the ER to the inpatient facility and helping out however she can wherever help is needed. My experience in the emergency department, most of the patients that I encountered were patients who were experiencing detox or withdrawing from substances that they were no longer using, or they weren't taking their prescribed medications as they should have been. So we had a lot of people who came in with uncontrolled AFib because they weren't taking their medicine for that. And then my experience with the community too, it was homecoming week while I was there. So I got to see the town come together and kind of all prep for the parade and cheer on their football team. It was a time of a lot of excitement for all of the people that lived in Sturgis. And they have a large school district with lots of kids. So that was fun getting to see everybody participate in the parade that went through the town of Sturgis. And then also being in the emergency department, I got to see their coordination between their emergency response sources. And those are really great between the police services, fire department, ambulance, and the ER itself. Every time we had to transfer somebody out, the ambulance was there within 10 minutes. And if we had like violent patients, the police would respond within 10 minutes as well, and they would be there just to hang around and watch and just make sure everybody who was staffed in the hospital felt safe. Some other things I noticed about their town was they have a lot of local parks, but the people that live there felt like the parks were in more need of work. They said that it was often overgrown with grass and there was no like public bathroom access at these parks that weren't maintained well. So that was hard on the community members, but they do have parks, which was cool to witness. And then in addition to the hospital of like the inpatient unit and the ER, they have urgent care, which is attached, and they have about 8 rooms that they see people in that come in. And since these are located in the same building, a lot of people have an easier time of differing if they need urgent care versus emergency care, which can save costs on families, which is nice because they kind of have like a little triage system in place where they can be guided to the right area. And they also had a nursing home attached to this facility. So if any residents had like a fall, for example, and began to experience hip pain, they were able to come to the ER right away and be seen.
Right. It sounds like a wonderful community. Oh. And a great hospital there as well. So moving on now, we're going to talk about barriers to accessing healthy food in rural South Dakota and what our nurses saw when they were in these settings. And so moving on to the next slide, we're just going to ask our nurses if anybody, the 3 of you, have anything to share about how did you recognize any food insecurity due to the geographical location you were in? And anybody can share.
The
So
town of Sturgis that I was in was actually very fortunate. They had 2 grocery stores available to them. and community members were able to travel if they were able to about 25 miles to a Walmart to afford other foods as well.
DeSmet has a Maynard store, which the town uses like their grocery store, but it's not like a full grocery store like we have here in Vermilion. So they have like some prepackaged salad options and some lunch meat and some milk. That's kind of the extent of the groceries you can get in DeSmet. So you have to travel to the Huron, Watertown, or Brookings area to get more groceries than what Maynard's has or what you can get at convenience stores.
Okay.
Luckily for Huron being like almost directly in the center of South Dakota in that rural area, we had a Walmart, a Coborn's, a Lewis Drug. So we did have quite a bit of options there. So the isolation wasn't too bad with the geographical location, which is kind of surprising because it is like smack dab in the middle of South
Sure.
Dakota.
So how about economic constraints? Did you notice like higher food prices in the rural areas or anything, any economic, which we understand the poverty areas throughout South Dakota and the rural areas. What did you see concerning economic constraints?
I only ended up going into the Walmart, but I do think, if I remember correctly, the prices were a little bit higher than the Walmart here in Vermilion. But I didn't see much of the poverty side of things per se. I know it does exist. Huron seems to be, from what I saw, seems to be kind of expanding. And so you're seeing a lot, like the outer edges of town you see a lot more nicer apartments and stuff, and that's kind of where the stores are located, are on like the outer edges of town. So it's kind of hard to see the difference between the store, like where the stores are, and the
Sure.
like poverty population.
So you, many of the majority of you, I think 2 out of the 3, talked about how, the cultural differences that you recognized. Were you able to find any food selections in these communities that supported cultural preferences in the community?
So in Huron, I think there was about 5 or 6 Asian grocery stores, and as well as 1 or 2 Hispanic grocery stores as well. So that was interesting to see because you don't, like, with such a small population, I wouldn't think to see that many stores for other cultures, but it was very interesting to see that.
I have a question for you guys. In those 3 communities you were in, do you know of programs or resources available for the people who were like homeless or in severe poverty that couldn't buy from a grocery store?
I know in Huron there were there's like food banks around. There's 3 stationary, and then there's the Helping Hands, which is a mobile food bank. I'm not sure about other resources for food. Obviously there's like SNAP benefits and WIC. But I didn't see a whole lot of that end of things. Even in the clinical setting, a lot of our patients were able to afford food and healthcare.
Just to touch a little bit on that as well, in DeSmet, they didn't have a food bank, so the community members can get the SNAP and the WIC benefits, but then they still have to go to Huron or Watertown. They have to go to another town that's a 30-mile commute to kind of utilize most of those benefits, because with the limited resources available in DeSmet, there's not, a really good, efficient way to best utilize those benefits for those families.
And I think we're also, this kind of is taking us right into our subject matter expert here, talking about food insecurity, and that, many rural families face food insecurity just because of the inconsistencies and the challenges, economic challenges, geographic challenges, and needing that emergency food access. So we're going to move on to our next slide. And it is my honor to welcome John Lushbaugh. He is a USD computer science teacher here at USD, former. He was here for over 30 years. And in 2001, John identified and developed the Welcome Table here in Vermilion, South Dakota. He was the founder of the Welcome Table, which is a free weekly meal for the underprivileged. He is also head of the Vermilion Weekend Backpack Program as well. And John has received many awards for his service to the community of Vermilion and the surrounding area. And one of the comments I found when looking through his long history and biography yesterday is that it's really recognized by many that he treats everyone who comes into the door with dignity and is welcoming of everyone. So we're having a little technical difficulty today. So John is not on our video, but I have him here on audio. And so John, I'd like for you to start saying some words here to see if everybody can hear you okay.
Well, let's try.
Okay.
I'm not having any trouble hearing any of you, but I'm not sure it's gonna work the other way.
Okay, can the audience, are you able to hear John okay?
Yes.
Okay, awesome, great. Okay, well, go ahead, John, if you would mind sharing with us about access to healthy food in rural South Dakota and the work that you do and what you know about these challenges.
Well, thank you. I appreciate the introduction and the opportunity to sort of talk about what goes on here in Vermilion. I'm part of a larger organization. We have something called Feeding Vermilion is our parent organization, which has only been formed about a year ago. And it's basically a merger of the Welcome Table on its programs and the Vermilion Food Pantry. We've been working together for a long time, and we finally decided to formalize that. And it's working really well. We're very fortunate to have a nice building downtown Vermilion that we've been in 5 years now, and it's got a very nice area for the food pantry and for our Welcome Table meal on Monday nights. The Welcome Table itself has been going for about 22 years. And we had no idea what we were doing when we started. I'd like to emphasize the we part. I didn't start it on my own. I had a lot of help, and still do have a lot of help. But I think in 2009 we started Weekend Backpack Program to help serve children who might not have enough food to go around during the weekend. And these programs are found everywhere nowadays. And it's been a very, very rewarding program to be part of. About 5 years ago, we added another component to that weekend backpack program. We actually started a food pantry for children. And so if you want to be a part of this program, it's not based on anything but whether you want to be part of this program or not. You just have to sign up, and you have to decide whether you want to come in to the pantry and pick up food, or whether you'd like it delivered to the schools on the last day of the school week. And you can't believe how much food goes out in here for those that participate in Tanger Takeout. That's our school pantry. Because we have, I mean, it's a small grocery store that we have, really. So there's all kinds of food that we couldn't put in a backpack. There's frozen food, all other kinds of food as well. I think the other thing that I'd like to point out is that since we started the weekend backpack program, we worked closely with Feeding South Dakota, and we sort of used their guidance as much as possible. We get a lot of food from them. Can't remember where I was going with this.
Yeah, John, I think that's, could you tell us more about the Feeding South Dakota group? And I know they sponsor a lot of activities, but how do you collaborate with them?
They're just an amazing organization. They essentially have 3 food banks in the state. There's one in Sioux Falls, one in Pierre, one in Rapid City. And the one in Sioux Falls was recently opened. By recent, I probably 6 years ago or something. It's just an unbelievable facility. So basically what we're able, if they have what's called partner agencies, and the partner agency then can order food from them. And the way that works is that if they have food that's been donated to them, they just charge 18 cents a pound, and we get it delivered here every Thursday morning. They also get other things that they're not able to get by donation, and we pay more. We probably pay closer to a wholesale cost on those, but we would not exist in our present form without being part of Feeding South Dakota. They've just done so much for us and continue to do so much for us. I just don't know how we get along without them.
That's great to know that, and know that there is this nonprofit group in South Dakota that's focusing on.
They're part of a larger organization called. I mean, they're loosely affiliated. I don't know how loose it is, but they're affiliated with Feeding America, and I think it used to. Well, I can't remember what it used to be called. It is. I mean, they're located in every state. And Feeding America is just sort of a parent organization that gives guidance and help.
John, are you aware of specific challenges in rural communities across South Dakota, with Vermilion being a rural community? Do you see that rural communities are hit harder or not? Is it the same across the state?
Actually, Vermilion, since we've been doing the weekend backpack program, we look at food insecurity rates, and we look at the food insecurity rates that come from Feeding America. And I think they've gone, there's a one for adults and there's one for kids. And I think ever since we've been involved, those rates have gone up every year. So we're talking about food insecurity for children to be 25%. And Probably for adults, it's around 20%. It was just that when we started all this, we were just dumbfounded that there was just that much need, and the need just grows every year. I mean, since COVID, it's been crazy how much food prices have gone up, and we are very fortunate to be in a generous community. We're fully funded by donations. We get help from our United Way. Really, United Way has been a huge benefit to us. But I'm just surprised every time I'm at the food pantry how many people we serve. And there's a real need. There's no question about it.
Does anyone have questions for John?
John, if people had interest in getting involved, either in Vermilion or in a community where they're at, who do they reach out to, or how would they go about that?
I think I need that question repeated.
Sure. And the question is, if somebody wants to get involved to help, either here in Vermilion or in another location in South Dakota, how would they do that?
Well, we have the United Way actually has a United Way of Vermilion, which is, they have their own website. They have a sign up place for volunteers. And also Feeding South Dakota has links to places where you can help in other areas in South Dakota. One thing I forgot to mention is that Vermilion has typically been one of the poorest communities outside of a county that has an Indian reservation anywhere in the state. And that's just unbelievable.
Yeah, it really is. Yeah. Yes. Any other questions for John or our nursing students? Well, John, thank you so much for being with us today. We so appreciate. We're sorry about the technology problems, but I'm so glad that we could still hear and you can share all the good work that you are doing here and how we can help for those of us that are located in this area. And also thank you for the South Dakota and also the national access for our practice partners. So John, I'm just going to have you stay on the line, but thank you so much for sharing.
I'm a little embarrassed coming from 30-some years in the computer science department to be the only one that couldn't get in this meeting.
Well, it's not just you, it's all of us on one day or another. We all take our turns. So it cycles. So it all worked out well. So thank you so much, John. And so I'm going to hand it back to you, Stacy.
Are there any other questions that anyone has at this point? You can feel free to go ahead, as it says on the screen, to use your chat box, or we're able to unmute you if you want to raise your hand. Okay, we can move forward to the next slide.
And this is just an overview of our objectives that for our presentation today. And I think everyone did a great job of helping us to meet these. We identified health challenges in rural communities in South Dakota. We discussed the barriers to accessing healthy food in rural South Dakota, and also the value influence of access to food and its influence on health. And our John helped us to identify the severity of these problems and how ways that we can help. Because it really is important that we do need to value that influence of access to food. It's important for the health of children and adults as well. So.
Well, as we wrap up our session today, if you view on your screen, there is a link. I'm going to see if, let me put that back up. I apologize. If you would be so kind as to take a brief moment and share that with us. Your feedback is very important. It helps us with future sessions. I also dropped that in the chat. If it's easier just to go ahead and click on that and take a brief moment to complete our survey for today. Other than that, we'd like to thank you for taking the time out of your schedule again, from watching us wherever you may be viewing, either live or on demand. And thank you to our case study expert, Helene and Katie, and all of the students for sharing your incredible experiences with us today. Thank you, everyone.